हॅलो.
येस सर. गुड मॉर्निंग.
सर येतोय आवाज? गुड
येतो
मॉर्निंग
येतो.
सर.
आवाज
येतोय
येतो.
ना? हा तेच बघा. हा हा ते काय एकदा आपण चेक केलेलं बरं असतं ना, म्हणून म्हटलं
हो
एकदा आपण आधी हे करू. आणि सर पीपीटी पण शेअर करून ठेवतो.
हो ठीक आहे. मी
हा
शेअरचं ऑप्शन देतो.
हा हा.
आला का ऑप्शन?
नाही सर, ते हे येत आहे, डिनाईड म्हणून येते मला.
नाही, आता आला.
होस्ट इज रिजेक्टेड. आता आलं. तर दिसतोय स्क्रीन आता?
नाही, अजून तरी नाही.
आता येतोय सर मला. युअर स्क्रीन शेअरिंग स्क्रीन म्हणून येतोय.
हॅज स्टार्टेड शेअर. हां, आता आलं. येस.
आलं ना?
येस.
ओके ओके.
येस, इट इज देअर.
एक मिनिट, फुल स्क्रीन करतो.
तुम्ही करा. मी प्रमोशन करून आलो.
हो हो हो, येस.
सर्वांना रिमाइंडर देऊन आलो.
नक्की नक्की नक्की.
करा
नाही
तुम्ही.
हो
टेक
हो.
टाइम.
हा.
वी हॅव 15 मिनिट्स. आणि पाच
ओके ओके.
5 किंवा 10 मिनिटं नंतर चालू करू. लोकांना थोडा वेळ द्यावा लागतो यायला.
हो हो, चालेल ना, चालेल चालेल
100
चालेल.
पेक्षा जास्त लोक आहेत.
ओके, बरोबर.
यू आर हायेस्ट. यू आर द
अच्छा.
who is having
बर
highest number. More than 100
बरोबर.
people are there registered.
ओके ओके.
50 तरी यायला पाहिजे.
हा हा.
सगळ्या नाही येणार.
बघूया ना सर.
50 तरी येईल.
हो हो, चालेल चालेल.
नहीं नहीं, अब वो बोला, वो शायद इंटरेस्टेड नहीं है, खराब नहीं। आपके वो जो भारद्वाज को बोले थे, सब जगह जाके नहीं नहीं बोले, समझ गया। इधर भी बोलता हूँ कल इंटरनेशनल फर्स्ट डे था, उसके लिए तो बोला वीकेंड पे सर डिपार्टमेंट में जो बच्चे थे एक फायदे के आपकी पीडीएस के दैट कुछ क्विज के फेस पेंटिंग के so, वो कर लेंगे आपस में, कर सकता है। मतलब यही सेम काइंड ऑफ परमिशन आई हैव टेकन फ्रॉम द प्रिंसिपल ऑफिसर्स। अब उसको उन्होंने डाइल्यूट करके अपना दिमाग चला के सो क्लास रिप्रेजेंटेटिव्स को बोल दिए, वो इंटरेस्टेड है आने के। क्लासेस होने के बाद बच्चे आए दूसरे डिपार्टमेंट से, दूसरे डिपार्टमेंट वाले कॉल करके मेरे को पूछ रहे कि मैं जाके क्लैरिफाई करा, मैं अंदर बैठा हुआ था कि बैंक का कुछ चल रहा था। तो मैं पूछा सर लेकिन नहीं करती ऑफिशियल परमिशन, मुझको तो मालूम थी, क्यों उसके लिए पूछे अननेसेसरी। एंड व्हाई थिंक आई शुड बी नोइंग ऑल दिस थिंग्स राइट। मेरे को कॉल्स आ रहे, तो मैं मेरे को मालूम है कैसा करना है, तो व्हाई डोंट टेक क्लास में वो बुला के बैठ गया। अरे तुम गलती करेंगे, तुम बेकार काम करेंगे, बोले व्हाई डू यू ऑलवेज प्लीज मी इन सच अ सिचुएशन, आई डोंट वांट टू बी इन सिचुएशन। तुम जो है क्लियरली बोलोगे, वो हिसाब से आई एक्टेड एंड टेक परमिशन अकॉर्डिंगली। जबकि उन्होंने बोले प्रिंसिपल यू मेक अ फॉर्मूला सर्कुलर बनाओ तो पर भेजेंगे बोल के बोल, उसकी जरूरत नहीं है सर, डिपार्टमेंट के अंदर कर लेना थोड़ा बहुत ही है। हाँ ठीक है तुम्हारे हिसाब से, क्योंकि वापस भेजा दिया हो बच्चों को, क्योंकि वो टाइम टेकिंग प्रोसीजर्स है पूरे, फेस पेंटिंग ये वो क्या है, दे इजीली हैप्पीली गो एंड कम, बच्चे कुछ करने का ना रहता, एक्स्ट्रा करिकुलर मिल रही अटेंडेंस ही मिल जाए ना हमारे को।
सर ये हिंदी में होगा या इंग्लिश में होगा?
ये स्पेनिश में होगा।
तब तो
इट
कुछ
वुड बी
समझ
इन
आएगा
इंग्लिश।
नहीं।
नहीं नहीं, इंग्लिश में होगा। Somebody was there. We have some international members also this time. Don't worry. He forgot to mute himself. Anyway, sir, we can start. It's 11:05.
Uh,
Recording is there. Okay.
yes, sir. Yeah, yeah.
Reminding everyone, recording is there. We shouldn't have spoken, but anyway, no problem. We'll manage. So, good morning to everyone and welcome to ADC webinars. This is 160th webinar for Dr. Tapan Yeolekar. He is going to present Pediatric Dentistry Simplified for Private Practitioners. Dr. Tapan Yeolekar is a passionate pediatric dentist. He completed his graduation from ACPM Dental College, Dhule, and post-graduation from Sri Siddharth Dental College, Karnataka. He stood second in the university, bagging silver medal. He is into exclusive pediatric dental practice since 2014, consulting across Mumbai and Thane. When his gentle and kid-friendly attitude, he treats little clinician, little ones with almost care and empathy. Apart from being a clinician, he has passionate to teach and impart pediatric dental skills among his colleagues. He has spoken on IDA and several other platforms several times. He runs an academy in Thane for imparting continuing dental education. He has conducted several lectures and hands-on courses on pediatric dentistry topics pan-India. Dr. Tapan is a recipient of Dental Innovation of the Year 2017 at Indian Health Professional Award. He is bestowed with Excellence in Periodontics of the Year 2018 at International Dental Excellence Awards. Currently, he holds the post of editor of IDA Thane branch from 2018 till date. So, welcome Dr. Tapan Yeolekar, and thank
Thank
you
you.
so much for joining ADC for today's webinar and
Thank you, sir.
providing your skills, sharing knowledge, and educating the members of ADC. There are
Thank you.
100 plus registrations. There will be people joining more. I am reminding each and every one and saying good morning to each and everyone. Once again, good morning to
I understand this is a Sunday, so we have to wake everybody up.
yeah.
Push up some adrenaline. True.
That's why I keep it as at 3 p.m. all my webinars.
3 p.m. is
So
a time when majority of get dozed off because that is the day when we have a peaceful sleep in the afternoon.
yes, and
Except for those who are attached to college.
free time from the practice, free time from family,
True.
free time from
Yes.
only the sleep is the thing which is the
Medicine.
yeah. So anyway, thank you so
Yes.
much for joining. Good to see you
Yes.
after a long time.
Same
We
here,
met
sir.
in Goa
Yes,
last
yes.
time.
Correct.
Good to see you. Yeah.
Yes, both of us were lecturing on the same dais, and I'm sir, should we begin or should we wait for others to join?
You can
So,
wait for 5 minutes. And if anyone is there, other ones who wants to interact with sir, you can go ahead. We can have 5 minutes
sir, we can
more.
keep interaction in the end because that would be much fruitful, I feel.
Yeah.
What do you suggest?
I would like to announce that
Ha.
I had announced that 1,000 rupees prize is there for
Yes,
the
yes,
quiz after the webinar. 5 questions are
yes.
asked by the mentor to the participants. So that is converted to more innovative way.
A mega prize.
Yeah, that sir is sir keeps on conducting courses. So he is conducting a course in Nasik and Mumbai. When it is, sir? Nasik and Mumbai?
Nasik is a 2 days master class in pediatric dentistry, and that is going to
Okay.
happen on 1st and 2nd of March, Saturday, Sunday.
Okay.
And Mumbai workshop, we are yet to announce the date, but tentatively it would be in the second week of April, post Ramzan.
Okay. March and April.
Sir, can you
March and
please
April.
share the details of Nasik webinar?
Sure. Definitely, doctor. I'll do that.
Yeah.
So, yes, sir. So, shall we
Actually,
start?
I'm in Dhule, so it will be
Her
better to
name is
come.
Srushti Poddar.
Okay,
We have
doctor. Next
sent-
week I am in Dhule. So, next Sunday I am in Dhule. We can meet in person. I am
Yeah, sir,
lecturing
for
at
sure.
IDA Dhule. I am lecturing at IDA Dhule along with Yusuf Chunawala sir. So
Okay.
next Sunday I'm in Dhule. The Sunday after that I would be in Nashik, Saturday, Sunday. So I'll
Yeah,
definitely
for sure.
share all the details in the end as well as I'll announce as Sudhir sir said there is a mega announcement in the end. So sir, let's get
So
started.
rupees
Good
1,000
morning,
for
sir.
the Nasik course, free 1,000 less for the winner, and 1,000 for all participants. Sorry, for all participants who are attending this
With a
webinar.
special promo code,
Each and
everybody will
every
get off.
yeah,
No bias.
1,000 and 1,000 off
Yes.
for the Mumbai course also.
Yes.
Idea is Dhule idea is already.
That's a free lecture.
Right.
That's a free
Yeah.
lecture for IDA Dhule members, and others there is some nominal fee of
There is
300
no
or 500. I'm not aware of it.
Yeah, so there is no discount for that. For Nasik and
Ha.
Mumbai, 1,000 less for each and
Definitely,
every
we
one.
are, because just for all members of
Unconditional
ADC, we have a special discount.
for ADC.
I'll share a promo.
For ADC.
Yes, for ADC, 100%. And I'll share a promo code with all of you. You can use that promo code because for Mumbai workshop, I am the organizer, but for Nasik workshop, organizers are different. So just to recognize you, you are an ADC member, I'll generate a promo code. I'll share it with Sudhir sir. Sir will post it on the group. And those who attended will definitely get the benefit of it. So, sir, let's start.
Yeah. Over to you. All yours.
Yes. Okay. So, hello, namaste, and sat sri akal, everyone. As sir has already introduced me, I need not to give a reintroduction of mine. But before I start with today's webinar, I would really like to thank organizer and founder of Academy of Dental Careers, Dr. Sudhil Dore, who is a good friend of mine, and we have been in touch since last 1.5 years, sir, if I remember correctly. We will conduct a webinar, and finally we could conceptualize it today on this Sunday. So, as sir has already announced, there is a mega prize at the end. I'll generate the promo code. I'll tell you the promo code at the end. And whatever doubts, whatever queries you have, keep them posted in the chat box. So please keep muted everybody, so that doesn't disturb the link. And since it is a Sunday, we'll start a bit late because, as sir said, few others are going to join us for this webinar. And let's get started with a brief introduction of mine. So to be very frank, I'm not a webinar person. I'm a person who likes to stand on the stage, be among the audience, have eye contact with everyone, and that's what I am. And I like it to be a very interactive one. But since it's a webinar, I can't see. So if anybody is sleeping on the couch, if somebody is sleeping on the sofa and attending this webinar, but I would like to tell you to everyone that keep enthusiasm of a 5-year-old and curiosity of a 10-year-old kid, because this is pediatric dentistry. So this will not only boost your pediatric dental practice, but the tips and tricks what I'm going to share today, they are going to be super beneficial for you in boosting your overall clinical practice. So stay with me till the end and we'll have a super Sunday. Let's get started. So I would like to start with a small introductory video of mine. So if you have these questions in your mind, then stay till the end, and the webinar is going to be super helpful for all of you. There is definitely going to be some take home for each and everyone. Even if you are not a pedo practitioner, even if you are not into pediatric dentistry at all, still there are going to be some takeaways from this webinar. So stay till the end with me, and we are going to solve these challenges together. So if you have problems, if you have challenges in managing a pediatric patient on the dental chair, this webinar is for you. If you get puzzled, you are administered local anesthesia, the child suddenly starts crying on the dental chair, and you are in a fix, what to do? Should I continue with the treatment? Should I stop it then and there and send the kid home? Or should I cry along with the kid? If this is your challenge, definitely I'm going to answer this. If you want to learn more about can you mute Dr. Beer? Thank you. So do you want to learn more about pediatric restorative therapy, how to do a painless restoration of a primary molar? You want to learn more about pulpotomy and pulpectomy? Then this webinar is for you. So let's solve these problems one at a time. Okay. So before we start with pediatric dentistry, just a minute, some issues with the rolling of slides. Just a minute, please bear with me. Okay. So before we start with pediatric dentistry, let's understand what is our overall approach towards dental treatment. So let's start with adult patients. We have adult patients on the dental chair. We ask them their chief complaint. Okay, a patient comes to us, we make him sit on the dental chair. We ask him, okay, what is your complaint? He tells us, okay, this tooth is in pain. So we run few diagnostic tests like dental percussion, radiographs, and we come to a conclusion or we arrive at a diagnosis in our mind. So once we arrive at a diagnosis, okay, this tooth is suffering from this problem, and the line of treatment for treating this tooth is either a root canal treatment or suppose an extraction, whatever it is. So this is your line of treatment. You decide, you discuss the same with the patient. He agrees for it. You agree, you tell him your fees for the specified dental treatment. He agrees for that. And then you start with that treatment. So the approach of treating adults in our clinical practice is what is a chief complaint driven approach. The patient comes to us for a certain chief complaint and we address that chief complaint. Am I right? And once the chief complaint is solved, then we make him aware of other things in his mouth. Okay, the neighboring tooth is also having a small decay. Let's get it filled. Other teeth need a scaling. You need a bleaching to get a good shade of your tooth. So this is what we do in case of an adult patient. So our approach is majorly a chief complaint driven approach. Now imagine, can we use the same approach or the same model for a pediatric patient? And if we apply, what is going to happen? Unfortunately, if we apply a chief complaint driven approach, a patient comes to you, 6-year-old comes to you, he has a pain in a particular tooth, he has not slept throughout the night, he has disturbed the parents' sleep as well, they are not going to their work, they're taken off, the child is not going to the school, he has taken off, and their parents are insisting you, requesting you, sir, madam, please finish this tooth treatment, whatever is there, we are ready to pay you the charges, but finish this tooth treatment today itself. So if you agree with me, type in the chat box, yes, YES, yes. So I understand that all of you are listening. My voice is audible to you. Please type yes, Dr. says Dr. Joshi. Thank you. Yes, says Dr. Shikha Sinha, Dr. Wrinkle. Thank you. So majority of the time, this is what the parents insist upon and this is what we do. But unfortunately, with this approach or a patient or a chief complaint driven approach, the treatment model fails because the child is not at all comfortable. He is not at all acclimatized or used to your clinics. The ice is not broken. You are not spoken to the patient. He has not expressed himself. And unfortunately, the line of treatment is with local anesthesia and the child gets scared on the dental chair and he starts running. And with that, your confidence gets dipped down as well. So next time a pediatric patient visits you, you are in a fix what to do. And once your assistant says, sir, एक पीडो पेशेंट आया है, क्या करें? This is what your reaction is. Am I right, doctors? What to do? Should I write a prescription and send him? Should I treat him on the same day? This is what we are, because parents are going to insist because they don't know. Our duty is to relieve the child's pain by some means and not to scare him in his first visit. That's a principle you should remember, and that would take your practice to great heights. So always have a patient-centric approach rather than a chief complaint-driven approach. So ideal approach for treating pediatric patients is you have to start communication with the kid first. You have to start talking to the kid first, and the kid expresses, or he or she expresses himself or herself. Once that happens, there is an environment, there is a overall, I would say, good feel for the patient. He feels happy to get treated by you, and then doing any possible treatment is not at all going to be difficult. So for that, the first and foremost thing is to break the ice, start talking to the kid. And for that, you have to take parents in. Sudhir sir, I'm audible? Some other ID is there or not, I don't know.
Yes, yes, you're audible.
Sir, we can continue, right?
Yeah, we can continue. Something happened in between.
Less than a minute it shows.
Yeah, some issues are there. That's what
Okay.
I'm checking.
So, should I continue? If it gets stopped, you'll provide a new ID, right?
Yeah, I will provide new ID. Yeah. You continue. If something happens, I will provide new ID. I will send to all.